Recording in progress.
Namaste. I am Dhiren Ganjwala. On behalf of the team Story to Tell, I welcome you all to the first session of this year. We are very happy to inform you that this year we have members not only from Gujarat, but from many states of India. Friends from Punjab, New Delhi, Uttar Pradesh, and Odisha have shown keen interest in this activity. And this is a first step in a direction of becoming truly national activity. The number of members from USA have also increased compared to last year. To expand our reach, we have decided to live stream few of our programs, and today's session is being live streamed with the help of OrthoTV and is being watched by many on YouTube. Those who are watching on YouTube, for them, this is a very interesting concept, and I would like to give you a brief introduction about Story to Tell group. Story to Tell is a group of like-minded people who have a learning mindset. We discuss topics ranging from history to geography, from science to technology, from medicine to mountaineering. And we meet online at every 3 weeks on Thursday from 9 p.m. to 10 p.m. Indian Standard Time. If you wish to join this group, please send a request on a WhatsApp number 97129 25600. I repeat, 97129 25600. We shall guide you how to join this group. Now coming to the today's talk, the expert for today's talk is Dr. Vikas Jain. He's an eminent orthopedic surgeon practicing in Vapi, and he will be speaking on a topic which is very dear and near to his heart. And he will be telling us about know your bone, love your bone, and save your bone. He's going to share very few and very important practical tips for every age group so that together we can avoid the epidemic of osteoporosis. The talk will be for 35 to 40 minutes, and after that we will have question and answers for 15 to 20 minutes. To avoid disturbances during the presentation, we have muted everyone. So please unmute yourself at the time of question and answers. Thank you. Over to you, Vikas bhai. Thank you.
Thank you so much, Dr. Dhiren, Dr. Tejas, Meenakshi Ben, and the entire ecosystem of Stories to Tell to have invited for the season's first talk, and that is on osteoporosis. And it is the disease of the bones which is so close and so near and dear to me. So as told by Dhiren bhai, this is a very interesting talk, and it is mainly to sensitize the community. Give me a second till when I start my presentation. So is the this thing okay? So thank you so much, Dhiren bhai. So stories to tell. Well, friends, let's understand what is the title. The title itself says so much about what you would be hearing from me as an interactive, as an educational talk to sensitize the community. First is know your bones, love your bones, and save your bones. Now, this is very important. This is very important for the entire mankind and for humankind to understand that we have been absolutely insensitive and highly negligent about our bone health. Friends, to introduce myself, I'm an orthopedic surgeon since last 25 years. I'm practicing orthopedics as a orthoplastic surgeon in Gujarat, in Vapi. Since last 5 years, after having done my MBA from Washington University and IIT Bombay, I'm into healthcare consultation, predominantly focusing on technologies, 3D, digital healthcare, startups, and optimization of resources and strategies. I have been associated with IIT Bombay very closely, and apart from the profession, now I believe into chasing passion and higher purpose in life, which should be true for all of you. So friends, this is a talk on the bones. As you would have understood, we will be talking about how the bones are affected and how we are unaware about the bones that get affected very slow and steady in our body. This is where I have my own unit, that is Arogyam Orthopaedics, and friends, I have been awarded by the honorary governor of Gujarat in 2021. That was for the entire social work that was done in last 2 decades towards mankind and humanity. This is His Excellency Governor O.P. Kohli of Gujarat. So between the birth and death, that is between B and D, what we have is C, and the C stands for choice. It is upon us, we have to choose. Do we want a life which is with pain, with disabilities, with fractures, and we are dependent on others? Or do we want a life which is fit, which is pain-free, which is enjoyable, and which has a freedom of movement? It is up to us. We have to choose. But for whatever choice that we make, there are a lot of things that we will have to understand, that we will have to change in our lifestyle in order to have that outcome. Why we are talking in terms of osteoporosis, friends? Because most of you in your families must have seen the effect of osteoporosis in form of fragility and fractures, which affects any elderly member in your family. So you would be either in the elderly age group, or you would be having parents who are in that age group, and they would be suffering from osteoporosis, which is not known to them as well as it is not known to you. And I will subsequently tell you that how big a socio-economic burden this particular osteoporosis is. Are we ignorant or are we negligent? I believe that most of the people who suffer from lifestyle diseases, who are having problems like diabetes, obesity, cancers, heart problems, and osteoporosis as a lifestyle disease, live a very unhealthy lifestyle. Now, we are the people, as human beings, we seek a very unhealthy lifestyle where we want to give a lot of comfort to our body. And that is the reason why the body does not like the level of pleasure and comfort that you live in, and it retaliates by having changes in the cells, in the tissues, in the system of your body in form of these diseases. It gives me a great pleasure to tell you, friends, that I work and I talk on longevity, and longevity requires us to understand that we have to overcome this deadly problem of osteoporosis or fragility of the bones. So we don't have to be ignorant. It is high time that we sensitize to all the possible preventable diseases, and it is predominantly in most of the people who are in the middle, upper middle, and the higher strata of the society. So they are all educated. What is optimization? So most of you must have understood that optimization is something where we maximize the use of the resources that are available around us. So in the businesses, most of you use optimization. You use the maximizing of all the resources that are available to you. The similar manner, this optimization principle has to be applied to our body. That means our body's anatomy, our body's physiology, our body's chemical system or the biochemical system or the industry, everything has to work on an optimization principle. Now, this is the core. This is the core essence of longevity. However, we are not covering longevity, but understanding osteoporosis, the similar optimization also applies to our bones and joints. That means the entire musculoskeletal system. And that is where we lack, and that is where we end up into losing very important strong and strength quality of our bone. Most of you, when I get patients in my OPD and I talk to them coming from the educated class, and when I ask them, do they know about osteoporosis? They say no. When I tell them that it is a disease where you slowly start losing the strength of your bone, and then they are surprised. That means we are now in a situation where knowingly or unknowingly now we are into a stage where the bones are getting weaker every day, and because it is so silent, we do not come to know about it. Here I have given you a very picture of the structure, the RCC structure of a building. Our body's musculoskeletal system is very similar to this RCC structure. So do you think a house or a building that stands on a weak RCC structure, do you think it is going to sustain or it be there for a long period? No. This building can surely fall. In a very similar manner, the musculoskeletal system, predominantly the bones, are in a very similarly the RCC structure of our body. And if this structure becomes weak, definitely the whole body has a chance to get fragile, and any form of a very force, by a small fall, which is insignificant, will result into fractures. And that is very detrimental, friend. We do not want a life where we get fractures without there are strong forces. We just put our hand and stand on it, or if we have a trivial fall, and then we start to get fractures. These are fragile fractures, fragility fractures. These are osteoporotic fractures, and they happen because the RCC structure of our body, that is the bones of our body, have slowly become weak. This is what again tells you a process which is so silent. Most of you have bank accounts. Imagine that you keep on withdrawing money from the bank and you do not deposit. So a very similar thing, a bone is like a bank. It has all the minerals, it has all the calcium. These are the things which give the structure, the strength. And imagine if all these minerals and calcium come out of the bone and there is no way that we deposit them back into the bone, what is going to happen? The RCC structure or the bones are going to get weak. So it works on a very similar principle of a bank. The bank is going to, at one day, you will lose all your money from the bank. In a similar manner, you will lose all your bone, the strength of the bone, from your bone bank. This is something which is very inevitable part, friends. Aging is going to happen, but what we understand is we think that osteoporosis is a part of aging. Let us now change this mindset. We have started to accept, the educated class also has started to accept that if we age, our bones are going to get weak, we are going to fall, we are going to get fractures, and it is part of aging. Now, this is the mindset that I feel that we need to change, because osteoporosis and the weakness in the bones is very much preventable. If you see, there would be warning signs. There are a lot of patients who come to us and they have complaints which are very similar to bone pains. They have complaints which are very vague. In the subsequent slides, we would be telling you where there would be we would be able to pick up the changes in the bones very early. But if you see, if you get these fractures, if you get these fragility fractures, you must have seen that in your family. They have a big burden socially, and they have a very bad impact on the quality of life. Imagine they get a fracture in their hip, they are bedridden, they have to do their day activities of daily living like toilet, everything on the bed, and then someone has to take care. Now, this is not what we like. The elderly people in our home, if you see socially, they don't like if someone has to do and have to serve them, help them with all those activities. But then you would not believe that we have now started to consider, out of 10 people, 8 people in our group will definitely consider, okay, we are aging, so this is a natural part of aging. We are going to get weak bones, we are going to get fractures. Friends, please, we need to change this mindset. We do not want the people who are now understanding osteoporosis to start from this very day believing that at whatever stage of life they are, we have to now think that our bones are in a process of getting weak, and can we bring a change, can we do some reversal? Start thinking that way. So a lot of patients who come to us as an orthopedic surgeons, and they do complain to us about, sir, we have lost our height, we are getting backache, we are getting vague pains in our bones, I am getting a deformity in our back. Now, all these are the very common signs, because these are the changes which have occurred in our RCC structure, our bones, and they have started to collapse. And once these micro collapse or micro damage that starts in our bones, they will immediately not give very severe symptoms. They start to give us very mild symptoms. It is at this time that you should not sit at home, should not apply hot fomentation, should not apply gel, should not apply iodex, and should not try to treat yourself, should not try to Google, but it is best that you go and consult your orthopedic surgeon nearby. We get a lot of patients. This was one of the patients, and you could be one. A 75-year-old male patient who had a fall in the bathroom while going to the toilet in the midnight. Friends, this must be a very common story in many of your homes. The elderly person, a gent or a lady who in the midnight going to the bathroom, going to the toilet, when they have a fall, they fall on their hip, on their back, and they have a fracture. Usually you have to lift them up, you have to take them to the hospital, you have to, once they are diagnosed with the fracture, they are then operated, and then the whole vicious cycle starts. The life of limitations. Now, this is not the life of freedom. This is the life of limitation. Are you choosing a life like that once you are in your 60s and 70s? Friends, it is up to you to choose. So it is very important that you realize that osteoporosis and the fractures, which are very commonly that are happening, are in the hip joints, it is in the spine, it is in the wrist, it is in the shoulder. And these fractures are very painful, and they really put your life into a very difficult situation. Choice is again yours. These slides are there to sensitize you. You should get worried, yes, that we could pass through such stages in our life. Do we want to pass through such stages in our life? Do not accept this. Start thinking as to what you can do to prevent from where you are to reach to a stage where you have full-blown osteoporosis. Let me give you some statistics. What happens to the patient once they get a hip fracture? 40% of them are unable to walk independently. That means lifelong, they have to walk with a walker or they have to walk with a stick. 60% of them require one whole year, they require someone to help them with their activities of daily living. 25% of these hip fracture patients who are treated by surgery usually end up in a mortality. Friend, that is not a very good statistics, but it is very unfortunate that these fragility fractures, osteoporotic fractures ultimately end up with the end of your life. So 50% of the people with one osteoporotic fracture will again have a chance to have a fracture again in their life. Now, so if you have one fracture in your 60s, in your late 50s, then you have to be very sure that how you would not like to have a fracture again, the second fracture in your life. As I was previously mentioning, try to understand that this is a big socio-economic burden. As you know, don't look at yourself as yourself and your family members. Think about the society, think about the community, think about how the people across the world would be affected as and when our population with geriatric people will increase. 1 in 3 of the females and 1 in 5 of all the males above 50 years of age get osteoporotic fracture. So if we are 100 people who are watching here, and if they are 50 years of age, you can just put yourself into that statistics and imagine that the chances that you can get an osteoporotic fracture would be within this range. One fracture occurs every 3 seconds, and from 1990 to 2050, the males and the females will have an added around 300% of hip fractures, which are going to increase in globally. Now, this is a very dangerous statistics, and if people do not get sensitized, it is the community, it is the mankind, it is the humankind that has to get sensitized to this particular disease. There is another patient that has come to my OPD, an 80-year-old lady who has low backache, vague bone pains, and she comes to me with a deformity in her spine. So, friends, just have a look in people around you. There would be so many males or females who are in their 70s and 80s, and they would be having a deformity in their back. And this deformity of the spine, or this hump that you see in the back, is nothing but it is a sign of them having osteoporosis in the bones of your spine. Now, this is something which also should give you an idea that how osteoporosis has been accepted. You accept this as part of aging. You accept this that the bones are going to be weak and we are going to have fractures. We don't want this. Do you want, when you are in your 70s and 80s, to lose your height? Do you want to have your spine looking like a hump and you walk with a hunch gait? I don't think so you would like to walk this way. So coming to this, friends, you understand that almost 33% of the osteoporosis microfractures that occur in the vertebra do not give any symptoms, do not give any pain, but they start to collapse and they are not coming to the OPD and they do not get diagnosed. Along with this, we have to tell you that all people who are suffering from obesity, hypertension, diabetes, who are having asthma, who are now suffering from corona, who have been given steroids, who have been suffering from cancer, and who have been taking chemotherapy, have been taking radiotherapy, are all susceptible to have affection of your bones. In order to understand, this will be causing secondary osteoporosis, but that means the chances that you will have osteoporosis is high, and you should get sensitized. You should go and talk to your orthopedic surgeon that we need to see to it whether we are osteoporotic or not. Very commonly seen again in your family, you must have seen that an elderly person who is walking with a walker, who already has a hip fracture, who's operated, again stumbles, or they fall from a stair and then they fall on their outstretched hand and they get a fracture in their wrist. So this is another part of the body for an osteoporotic fracture, that is in the wrist. So whenever you usually fall, We do not fall on an outstretched hand. Usually elderly people will have a fall on their back and they have a fracture of their hip. But many times you try to prevent yourself, and when you try to just save yourself and you put your hand, and it is a trivial fall, even by that trivial fall, you will find that you will get a fracture in your wrist. And that is nothing but an osteoporotic fracture of the wrist joint. If you see, most of you would understand that an elderly person in your family can have a fall. And this is because these people either are on some medications, or they have some form of balance disorders, they have some problem with vertigo, they are either having some, they might be having some alcohol or some weakness, cancer, which has, or diabetes, where they have a fall in the sugar level, which will cause a lot of weakness in their body, and that is the reason why they might have a fall. Another thing that happens usually in the night is postural hypotension. Friend, to explain you, when you are in a position of sleep and when you get up, suddenly the flow of blood that goes to your brain is reduced and you suddenly get giddy, and that is many times a reason that you start or you get a fall as soon as you are going to the toilet in the midnight. Why? To understand the fall in the elderly is important. That means we need to do certain changes in our lifestyle that will prevent us or prevent our elderly people. We are going to be in that age group, and we also have our parents who are in their age group. So there are a lot many things that you need to do. The ergonomics in your homes have to be such arranged, the lighting has to be there. You have to see to it that they are not having any postural hypotension, they are not having any weakness, they are not having lower sugar levels. You have to get their eyes checked up. You have to see that you have a non-slippery floor. You have to see that they have something to hold when they want to walk in the night. You have to give them enormous space. Don't keep your rooms very congested, so that they have a freedom of movement. The tiles should not be very slippery. Now, these are very important things, and there are many things which you can do in order to prevent these elderly people to fall, because if they have osteoporosis, they have fragile bones, they are surely to get a fracture. Now, if you see, a lot of importance is given to the problems like cancer, to heart, to diabetes, to blood pressure, to other prosthetic problems. But how many times have you given any importance to osteoporosis? None. Most of the times we don't even think about it. But if you see the statistics, we spend more days in the hospitals because of the fragility fractures, and the risk of the fracture as well as the morbidity or mortality. This means the fracture and the deaths because of the fractures is much more than any other disease. So such is the importance that we should be now giving in order to understand the osteoporosis. Let us understand how does a bone, when in our how does it function, as we age. So this chart tells you that in the very early, till your 30 years of age, what you do is you are building your bone. You are creating a strong bone by the type of diet, type of work, type of exercises, the play that the children do. All this will enable them to make their bones very strong. The mid age, that is from 30 to 60, is the time when most of the times we maintain the quality of the bone. This is at this stage where we need to maintain this for a longer period of time. However, we do not do that because of the poor lifestyle, because of the poor diet, because of the improper exposure to the sunlight. We usually lose our bone strength, and this is how the bones would fall. In women, of course, hormones and the menopause, which we will shortly see in the slides, also are the causes for losing the strength of the bone. But as we age, we have to be very sure that a stage will come when there will be peaking of the bone strength. Now, how long in your life can you manage to keep that peak of the bone strength depends on you. You can do that. And that is where the whole idea and concept of prevention comes. This is one point that I wanted to raise because a lot of people undergo hysterectomy. A large part of the hysterectomy happens in the ladies between 35 and 40 years of age. And you would realize that once you have removed the uterus, you have entered into a zone where you are highly susceptible to have weak bones. So your lifestyle, your lower levels of vitamin B12, D3, as well as hysterectomy all add up to a big imbalance, and the bones will start to get weak very fast. And if you are in the ladies of the age group of 45 in the perimenopausal stage or post-menopause or who are post-hysterectomy, you will find lot many symptoms of backache, weight bone pains, body ache, knee pains, and these would be all correlating to osteoporosis as well as variations and the lower levels of vitamin D3 and B12. This is something which tells you about how your hormones of the females are directly responsible for the bone building. So when a female is menstruating, she is in the stage where she is enabling a proper building of the bone. The time when she stops to menstruate, the hormones start to change, they decline, and that is when the bones will start to lose its minerals and they will start to become weak. Apart from that, there are other factors like alcoholism, smoking, improper diet. A lot of children in this age group are now, and even adults are taking to fast food. We all go to McD's, we all go and eat a lot of fast food. Mental health is another big problem, and it is also a cause to a poor bone health. Then there are medications, predominantly steroids, which we are taking for lot many problems. Corona again has been a reason where a lot of steroids have been taken. Environmental factors like impure air, not a good quality water. All this will accumulate toxins in your body, will cause an inflammatory stage. They will have cause poor oxidation, and all this will also result into poor bone health. So are you pre-menopause, perimenopause, post-menopause? Have your uterus been removed? Or are you a male who is above 50 years of age? Do you have taken steroids in your life? Are you alcoholic? Are you take smoking? Or have your elderly in the family had a fracture? Have you had a fracture now? All these things are very important, and all these are the risk factors that you should know, that your chances of getting osteoporosis is very high. So now what next? How would you know that what is the osteoporosis that you have? Even the men also get osteoporosis because they also have hormones which are known as testosterone, and variation in the testosterone levels also will affect the bone health. Now, this is where again the bone mass, I have already explained that in the stage between 30 and 50, you peak, and it is very important that you manage to keep the plateau and do not let the downfall happen as far as the bone quality is concerned in your 60s, 70s, so that you are not osteoporotic when you are 60s and 70s and you do not get fragility fractures. The childhood is very important, and in the present context, I am very sure Dr. Dhiren Bhai would understand that even children have osteoporosis, and it is the time when it is the stage when they should be bone building. That is the stage when mass of the bone is built, and that only happens when children go, they play in the sunlight. We are keeping our children on junk food. We are keeping our children on in the air conditioned rooms. We are keeping our children in air conditioned schools. They are traveling in AC cars. They are not doing lots of physical exercise. They are all on the mobiles, and all this will add up to a very poor bone health. The time when the children should add up their bone mass is the time where they are not actually adding up adequate bone mass. And then imagine their adulthood and their old age when they would really have a poor bone mass. We are in for a big disaster. So if you see, this is what has been told, that it is the childhood where you start to build the reserve. It is the adulthood when you start to preserve the bone mass, and you have to take all the measures to further preserve the bone mass. So this is something which is very same as I have been telling. I have already told you that 1 in 5 men and 1 in 3 women are suffering from osteoporosis, and we have to aim at reducing the fragility by 50%, so that the problems that are occurring at the level of orthopedics, where we get a lot of problems as far as osteoporotic bones are concerned, when we do put plates, when we put joints and these plates fail, the bones don't unite, the joints the joints fail, there are fractures that happen around the knee joints and the hip joints, and we all feel that this is normal. This is not normal. You all have osteoporosis, and what will the doctor do? What will the orthopedic surgeon do if you come with so much of weak bones and then you come with fractures? First thing is prevention. Then definitely, friends, there is a possibility that we can do medically, that we can treat. This is DEXA. DEXA is one way in which you can check what is the quality of your bones. So apart from few blood parameters, apart from x-rays, this is a very specific machine which is available at places, diagnostic centers, where you can do a DEXA, and the orthopedic surgeons can read from that and can tell you how good or how bad is the quality of your bone. So for you, it is important that if you feel that you have risk and you are in that osteoporotic range, you want to know what is the quality of your bone, please book an appointment and you think in terms of visiting your orthopedic surgeon, get your parameters checked, get your DEXA done, and be rest assured that you want to live a good life in future. This is a chart which will give you, but let me tell you, the best way is jogging, or you have to do brisk walking. Now, brisk walking, jogging, because lifting weights and jumping rope, hiking is not what everyone can do, but at least brisk walking is what everyone can do. And this also enables, because this increases your metabolism, it increases and optimizes your musculoskeletal system. So don't feel that just doing yoga or riding a bike can build your bone. So you can see that it takes your bone to level 1, while if you are doing brisk walking, it takes your bone strength to level 4. So this gives you a judgment. So do not be under an impression that I am a cycling person or I am doing yoga, so my bones alone would be strong by that. You can still do more to make your bones. So if there are dancers in the group, please continue to dance. And if you are walking, you should do a little bit of brisk walking, or if you can jog, that is a good idea. Taking calcium, again, is what many of you would be asking. So there are a lot of sources of calcium. Most of us would be vegetarians, and we should know that calcium is available in anything that is white. So milk products, curd, badam, bananas, most of them would be having adequate amount of calcium. But the problem is that we try to find shortcut. We try to eat calcium tablets every day and we think we are having adequate quantity. But you would not believe that a lot of people are taking Esiloc, a lot of people are taking pantoprazole in their daily life, and they are not allowing this calcium to get absorbed. And that is also one of the reasons why, because the calcium that you take in your diet or that you take as form of medicine does not get absorbed in your body. How much of calcium you need? Approximately 1000 milligram is what you need, but it will again be very important that you absorb that calcium. This is very important. We should be avoiding alcohol, we should be avoiding smoking, we should exercise, but then what is important is exposure to sunlight. How many of you expose yourself to sunlight? Not many. Most of you are having homes. You put up curtains. You do not let that sunlight come into your home. If you have to go out, you will apply a lot of sunscreen. You cover your hands. You do not want tanning. But friends, believe me, there are a lot of reactions in the human body. But main important reaction is conversion of precursor of vitamin D3, that is vitamin D2 to D3, only will happen if you expose yourself to sunlight, and it is good quantity and quality of sunlight is required for you to have strong bones. Can we treat osteoporosis? You will ask me. Yes. So once your doctor has done DEXA, once he knows that you have osteoporosis, he has to take a decision. There are medicines which are available. There are injections which are available, and the doctors will suggest you, and you can take those, and then you can start building your bones. Not much, but at least you should be building your bones in order to prevent fall, in order to have further fragility fractures. Children and osteoporosis happening in pregnancy, they're less common, but this is happening these days, that osteoporosis is seen in this age group too. So friends, to conclude, the future doctors will not be giving medication, but they will interest people like you, the patients, in the human frame with diet, and they will now be start talking in terms of prevention of disease. So that is what I am doing as a physician. We are thinking futuristic. Treating the disease is our forte, but the true physician will always educate the community, educate the patients to prevent. The prevention is most important than treatment. Thank you so much. Again. Dhiren bhai.
Thank you very much, Vikas bhai. It was a wonderful
Recording
presentation.
stopped.
You covered almost every aspect which is relevant for laymen. I know there are a lot of orthopedic surgeons, medical person in the group, but this is very pertinent for everyone. So you talked about the magnitude of problem. You also gave some scary statistics that this is very common. But let me tell you that the statistics which he gave is really the correct statistics. And that is what we see very commonly in our practice. So with that, we open the session for questions and answers. I request, please raise your hand. There is a function in the Zoom where if you raise your hand, that will give us an idea that you want to ask question. So please feel free to ask questions, because that's the most important part. The interaction is going to give us more understanding and better understanding of the situation and the problem.
So Dhiren bhai, you can also take questions along with me.
Sure, definitely.
So if there are questions, I'm ready to answer. I would
Yes,
want.
there is a question from Dr. Karna Desai. Karna, please unmute yourself and ask your question.
Good evening, everyone. It was an excellent narration of this common but ignored topic. I just want to ask two questions. Is there any role of vitamin D supplement in general or in prevention of osteoporosis? So many doctors of functional medicine are recommending at least 4,000 internal units of vitamin D daily. And in the time of COVID, we have seen that those having low vitamin D level having higher rate of hospitalization. So is there a role of vitamin D supplements routinely?
Can I take that question, sir?
Yes. Yeah, please. You have to take all the questions.
So, sir, let me tell you that we have to have adequate levels of vitamin D in our body for the normal functions, normal physiology that is required in the body, the biochemistry, the physiology. Usually it is seen that we have very low levels of vitamin D, and the reason is our lifestyle. Now, the role that vitamin D plays is very important as far as the bone health is concerned, because the proper function of the bone health happens with the adequate levels of vitamin D, which again is because of the conversion of D2 to D3 that levels. Now, how vitamin D is given is very important. It will depend on the age group. It will depend on how much low levels that you have. There are newer molecules which are available. You are given in form of tablets. We have nano formulations which are available, which are given in order to load vitamin D3 now. The idea is to have a sustained level of around 50 to 70 nanograms per ml, and that is the level that we want to manage, so that you do not get symptoms because of the lower vitamin D level. And of course, osteoporosis is not what you want, definitely. So yes, vitamin D is very important, and it has multiple other uses also in our body.
Right. Thank you so much. And second question, all male above 50 years should go for DEXA scan, as you said, they all are at risk, even though
So
they are.
now, I will tell you, sir, please try to find out whether you are having any other associates. So if you are having alcohol, if you are having taking steroids, if you are smoking, and if you are having medications, if you are having diabetes, if you are obese, if you are suffering from any lifestyle diseases, and suppose you have symptoms like you have bone pains, you have an elderly in your family who has already had a osteoporotic fracture, you are all at high risk. So this is you to take a judgment, but our studies that are happening globally for women, let me tell you that 88% of the women who are in the menopause stage have osteopenia. Now, osteopenia means osteoporosis, one stage before, they are in the very early stage of osteoporosis. They have a low bone mass and they are highly susceptible to get fractures. That disease might, while males, we have to definitely think in terms of getting ourselves checked up, at least what is wrong on the day of your birthday. If you can go and ask them to get a checkup for your bone health, so that you know, I have a stronger bone or not. Let me check that out.
Okay, thank you so much, sir.
Thank you so much.
Vikas bhai, Neela Ben, can you ask question? There are a few questions in the chat box that we will take later on. Neela Ben, please unmute yourself and ask question.
Thank you, Dr. Dhiren bhai. I am Dr. Kirit Shukla, Neela's husband.
Okay, please.
Thank you, Vikas bhai, for the nice lecture. I was curious about any suggestions about the timing of the day for exposure to the sun.
So, again, these are different myths. Ultimately, if you expose yourself to the sun, one is at what hour? So, comfortable time that I suggest to my patients is in the morning time when there's a sunlight. So it doesn't matter. Ultimately you want the UV lights, you want the sun rays to come and expose to a large part of your body part, so that they get absorbed and they enable the D2 to D3 conversion. So what is the comfort? The comfort would be in the time when it is not too hot. So the early morning sun, and again 15 to 20 minutes of a good exposure to sunlight almost on an alternate day basis, if you cannot do it on a daily basis, would enable you to have at least one factor of exposure to sunlight, because we have in our daily life almost nullified ourselves to exposing ourselves to sunlight. Now that is a very big problem.
No, my question was because one of the colleagues said that rising sun is good. Someone else said that it's between 9 and 10. So
no. Don't take that with a pinch of salt. What I want to say is a comfortable ray of sunlight to your body for 15 to 20 minutes would be good enough for you to do that particular dose of conversion. So there are no statistics which say that you take sunlight at this hour, you take it for these many minutes only, and this will help you more. But at least exposing good part of your body to a comfortable sunlight, because you cannot go at 12 in the noon and go on the terrace and then open your shirt and stand. Now that is not something what you would want, and what happens to the ladies. So you have to see to the privacy, you have to see the comfort of the temperature, as well as you have to see to it that you are getting that adequate rays of the sun which are exposing to the body parts.
Okay, thank you. And what is the role of depot preparation like injection erythritol 6 lakhs units in a deficient patient? Suppose you give it as a bolus.
You 6 lakh units.
One stat, and then you switch him over the oral therapy. What's your advice?
So there is a bolus dose. You are talking in terms of D3, right?
Yeah.
So very, very deficient patients who have less than 10 or they have a lot of symptoms because of D3 deficiency. There are people who now, so there are multiple theories. Nowadays, there is a bolus of 60,000 IU given for 10 days. It is available in a nano solution. This is the latest. And so that is again coming down to the same thing, 6 lakh units given over a span of 10 days, which will give your D levels, vitamin D3 levels to rise from say 10, 12. It will take it to around 70. And then again, once you put them on a sustainable sustenance, it will bring them to around 40, 50. But simultaneously, if you improve your lifestyle, if you're doing some form of exercises, exposing to sunlight, improve your diet, then you would be able to manage to maintain your vitamin D levels. See, we have to, the biggest epidemic now you see is every second patient coming from a upper middle or a upper class of society with generalized bone pains. You do find them having lower levels of B12 and D3.
And do you recommend vitamin K2 along with oral calcium, because somebody are concerned about getting that calcium deposited intravascularly? So
it will all depend on absorption of your calcium. So believe me, oral calciums do not get very well absorbed. If you'd ask me, I would want them to have a good amount of dietary calcium, and we have to also see to it that they are not taking a lot of antacids. People are on pantoprazole, people are on antacids, and they have malabsorption syndromes, and they do not have a proper calcium absorption. So that is where the lack of calcium comes. While if you take a good diet, mostly if you have a vegetarian diet also, you can have a good calcium intake through diet. Calcium tablets, people do get a lot of problems, absorption. So calcium deposition, excessive calcium absorption and calcium deposition is something which is not much of a things that we see daily, day to day.
Okay, sir. Thank you.
Sanjay Bhai, please unmute yourself and ask your question.
Yeah. Good evening, everyone. See, I have a simple question. Would swimming as a regular exercise help in counter this osteoporosis?
Yes. Swimming is a real good exercise, and the only problem is that this cannot be advocated for each and everyone, because everyone do not have those resources to access to a swimming pool. While it is a wonderful complete body exercise where your entire musculoskeletal system is optimized, and definitely understand that every time that you are optimizing each and every bone, muscle and joint of your body, you are trying to take your bone in a very dynamic stage. So bone turnover will be in such a manner that there will be laying down of a fresh new bone, and the breakdown of the bones will reduce. I 100% accept that swimming is a good exercise. And if you can swim early morning with sunlight, you are solving both the problems.
Okay, thank you so much.
Vikas bhai, there is a question in the chat box from Dr. Siri Salurkar. His question is whether the bone mass building can help in prevention of osteoporosis.
Muscle mass.
Muscle mass.
Yes. So now this is something, to the youth that I would like to say is please consider the fact that there is something which is known as muscle building, and then there is something which is known as muscle toning, right? Now, excessive muscle building that usually the bodybuilders would do with consumption of excessive proteins is really not required for your body or for your bone mass.
Even
However,
steroids. Even
you
steroids.
and steroids. So this is happening. This is happening with the youth. Everyone wants to become Salman Khan. Everyone wants to become Hrithik Roshan, John Abraham. I don't know, but this is not required. So muscle building, yes, we do not want our muscle to lose its mass. So when you do any form of yoga exercises and you are doing some exercises which are regular to keep your muscle tone as well as your muscle belly to be normal, but it should not go down. There should not be breakdown of the muscle, but you don't make your muscle big, huge, bulky. So you have to optimize. Optimize means it doesn't mean you make them huge. Optimize means you really want that muscles to be in the size it is meant to be in. That is most important. But yes, any function that is happening across the bone, like muscle functions, exercises, will always again positive dynamic process happens in the bone, and the laying down of the bone happens and the bone breaking reduces for sure. But I'm not talking in terms of bodybuilding of the muscles, for if the question pertaining to that.
Yeah, Tejas bhai, please.
Haji. Vikas bhai, excellent. Kudos to you. Very wonderfully put. And a topic which is so important and yet so ignored. I have three aspects to ask you and also maybe add something. One is, what about regular consumption of oral vitamin D tablets or powder or whatever is available? There is one. I'll ask my questions and you can answer them together if you wish.
You can ask them all together.
Yeah. Second aspect is that not as a prevention, but once I asked you this before also, that once osteoporosis is established in a fairly moderate to severe form, then we have talked about exercise, exposure to sunlight, consumption of vitamin D3, calcium, and other advanced drugs. So once osteoporosis is established, what amongst this is actually going to re-strengthen or add to the muscle mass? And the third aspect is, I think everybody should understand that banana is actually not a good source of calcium. Please Google. Banana gives you 6 to 7 milligram of calcium in 100 grams, while same amount of milk, 100 ml of milk, gives you 125 milligram, 25 times more. And that is why milk, and I would really advise against being vegan in this manner. Beans are another replacement, good replacement for, if you are a vegetarian, then beans and fruits and dark green leafy vegetables. But banana is probably, you are adding a lot of calories in hope of calcium, but it is not a good source of calcium. Please, Vikas bhai.
And now coming to oral vitamin D. So it is again depending on the physician who has checked up your vitamin D levels. If they are very low, initially you need to give bolus. So the bolus is usually given as either 6 lakh units or 60,000 international units to be given for 10 days, which is now available as a new form of bolus therapy. Maintenance of vitamin D can be done by continuing to take vitamin D in form of tablets, which are available in combination with calcium, magnesium, vitamin K2. Now, this is something which has now come into the market because all of us have been mineral deficient. Now, let us understand that why we are mineral deficient. Now, the mineral deficiency is again because of the water that we are demineralization and consuming, right? So now you need vitamins, you need minerals, and all these things which would have come to you by a proper source of water and food. Now you are trying to get them through tablets. This is something which again is not a very conducive thing. So we as a community, as a people, now should start thinking about how we should improve the quality of water, how we should improve the quality of food, and how we should have which are the types of food which will give us everything in a balanced form. Why do we want to take them in form of tablets or medicines? But definitely when you go to a physician and they'll have lower levels, apart from the dietary advice, you will always be given tablets in a sustainable form in order that your levels would come to, or they rise at least to a normal level. That is point number one. Point number two, which you were
Already
asking about.
established osteoporosis, what
Yes,
would help?
yes. So once you have gone to your orthopedic surgeon and he finds out that you are having osteoporosis, there are ways in which they find out. There are scores. I will not go into details because there are people who will not understand that, but there are medications which are available. There are two types of medications which are available. One is known as anabolic, which we call as bone building. So this will make the bone, and these are available in the injectable forms, which we call as teriparatides. And then there are second injectable forms which are available, which are known as denosumab, which are monoclonal antibodies. They are anti-resorptive agents, means they prevent the breakdown of the bone. So understand, there is something which is breakdown of the bone, and there is another which is known as bone building. Now these are two dynamic processes, and then there are medicines which are available which will enable the bone building, and then there are medicines which are available which will reduce the breakdown of the bone. Now it is up to the physician to decide what injections to be given, how much to be given, for what duration, so that at least you are improving 5 to 10% of your bone quality.
My question was mainly the conventional forms of bone building, which would prevent osteoporosis. But how useful will they be once osteoporosis is established? Like
they would be very useful, sir. You cannot
like sunlight, exercise, calcium.
They will. You have
They
to
would rebuild the bone also. They would rebuild the bone also.
So if you ask me from longevity point of view, till you are alive, everything has to continue.
Srinivas Bhai, please unmute yourself and
I just had a small comment to make regarding the gentleman who said that the bananas are not very useful. Bananas have a lot of trace elements which also help to make bone. It also has bromium,
No,
which
I
helps
said only about
calcium.
calcium. I mentioned only as a source
Yeah,
of
but it has bromium, which helps to aid calcium absorption from the gut. Calcium is just 10 to 12% absorbed, but this improves calcium absorption. So banana is not a no-go. You can take banana, it is helpful. But you cannot depend on banana because it is not a very rich source of calcium in itself.
That's what, yeah.
Thank you.
And
Yes,
lots of
Jawar Bhai,
calories.
please.
Jawar bhai.
Vikas, wonderful.
Thank you. Kem cho?
all fine, all fine. As usual, you have given very
Yeah, please
clear-cut
don't
ideas.
cross talk. Please ask
Yes.
ask the question.
Now, no, let me appreciate at least. So now my question or my comments are, yes, banana is zero calcium. There are 50% reports zero calcium, 50% say 5 milligram only. Now, it is true that banana helps in building the bone. The way the other person has explained is indirectly. It stimulates and it absorbs. Second correction is that it is not yoga on the lowest side. Yoga, some of them can definitely prevent osteoporosis. Thirdly, very important is, which is the best diet, is sesame tal. Tal is having 975 milligram in 100 gram. It is the highest, even more than mutton or non-veg. That is also very important.
Sir, tame ragi bhi ko ragi.
Ragi, yes. Ragi is also
Because
very.
This is something which we don't eat, but ragi, I don't know if most of them know. Ragi is a very rich source of calcium.
So what I advise is that you take as a mukhwas shekela tal. That is the highest of the calcium. Now, one point which is very important is that how to prevent osteoporosis. It's very easy. You know, 1 in 3 in women and 1 in 5 in men. So make them rest of those 4 men your friend. And go with the recreation. The way they live, try to mimic. And that is the best way to see how you can prevent this. But because my point was that how come these insurance companies when they take up our Mediclaim, they always go for a full body checkup before they approve our premium. And they do not go for a compulsory DEXA.
They
So
do not
that
go
is
for compulsory DEXA.
DEXA. So
Yeah.
I think that is the place where I am giving such a huge amount of my premium. See, I have just crossed 65 years of my age, but I have not found that that should be a part because it is in benefit of the insurance as well. So I think if it can be accommodated into that particular.
So insurance companies are paying huge. If you ask me the statistics, sir, the fragility fractures which most of our orthopedic surgeons are fixing and which are reimbursed by the insurance company amount to 22% of the claim settlements that are happening across India. At least I know that. So that means if you think in terms of claim settlements from trauma and fractures and joint replacements, and if they are sensitized towards DEXA and prevention of fragility fractures, definitely it's a benefit to the insurance company. But I don't know, maybe this aspect is not thought about.
Yes, yes.
Vikas bhai, there is a question from one of the viewer. She has mentioned Toshiba. What a patient of post bone marrow transplant who has early menopause has to take to maintain the good bone health? Is it advisable to have calcium supplements and vitamin D for the whole life following bone marrow transplant?
Now, because these people have got, because they have taken bone marrow transplants, definitely there would be limitations that would be advised by the dietitians that are there for them. But taking calcium and few vitamins definitely are not contraindicated. That is what I am very sure. Again, improving on the lifestyle, which is very much in their feasible limits, like doing some exercises, physiotherapy, which will enable them to maintain their muscle health, muscle tone, as well as the bone health, should be done. So it is not that if they have undergone some form of treatment, and again, if they are in their menopause or the perimenopause stage, they would be 100% in the osteopenic stage. So having physicians to work together, their physician and the orthopedic surgeon, if they are osteopenic, are they in a position to take medical treatment? Do they require oral biphosphonates? Can they take or not? This has to be correlated. It has to be along with their physician. We'll have to work on that for sure. I'm not very sure on that.
Thank you. Then there is another question in the chat box. The question is, if we take calcium supplement along with vitamin D supplement, will that be sufficient to prevent osteoporosis?
So this is something, again, I have already answered. Why are we trying to find shortcuts? Again, this is a very typical mentality that we have entered into, where we do not want to think in terms of improving our lifestyle. We are not thinking in terms of improving our diet, the quality of our diet, and we just want to think if we pop up a tablet of calcium and vitamin D3 and we would be. These people are forgetting that it has to do with absorption. The absorption of these medicines are poor. Suppose you just live a very poor sedentary lifestyle and you just pop up calcium and vitamin D3 tablets and you think you won't be osteoporotic, they are highly mistaken. So this answers their question that no, you should not only think in terms of having a calcium and a vitamin D3 tablet and then you think they will not get osteoporosis in your life. You have to improve upon your lifestyle, which is most important.
Yes, Jamal bhai.
Yes, I just want Vikas to explain that there is a vicious circle of osteopenia going to sarcopenia, again osteopenia and going to osteoporosis. If you can elaborate on that, people would be,
Sir, you can elaborate on that, no problem. Because
so the point is that sarcopenia is something like decrease in muscle mass.
yes.
So even if you feel like that your body's muscle mass is decreasing, it may be there is a hidden osteoporosis or osteopenia which leads to sarcopenia, And it is very well beautifully can be checked on MRI, where you can see the quality of the bone mass, I mean the muscle mass. But very important part is the moment you correct sarcopenia by doing exercise, in turns when it goes to, as very rightly said, proper size of the muscle, which lead to again preservation of the bone stock, and there will be less problem of
And
osteopenia or
this is
osteoporosis.
very important for a perimenopausal women, because if you see in our day-to-day practice, if we see these patients, they have a lot of fat and they have a very poor muscle mass. So women who come to us usually have a poor muscle tone and they have a poor muscle mass. And these women are more prone to osteoporosis. That means they have to start thinking in terms of changing their lifestyle. They don't have to go in any forms of muscle building exercises, but at least they should build their muscles to an extent which are normal, and their muscle tones should remain normal. So that is very important, because that will enable them to build their bones. Otherwise, they will lose their bone quality very fast.
Yeah, thank you, Vikas bhai, for very good answering the questions and solving the doubts of our viewers. I really appreciate the information, and I'm sure that this will definitely help us in preventing the suffering and misery to great extent. And it's always said that prevention is better than cure. And
Always.
probably this is one condition where that saying goes really well or very applicable for osteoporosis.
Yes, sir.
So with that, I thank our viewers, Dr. Vikas bhai and OrthoTV, for like making this session possible. And for the next session on the 4th of August, we are planning one wonderful interaction with our renowned uh, personality, that is Sonal Modi, and she is going to come to our gathering, and we are going to have a great interaction with us. We will give you more information in a due course, but please note down that 4th of August is going to be our second session. So with that, thank you once again, and bye-bye.
I would like to thank everyone for the patient listening. Thank you so much. And it is a very wonderful audience. Most of your questions were really nice. And we would, I'm always there, as my passion and as my purpose of my life, to see to it that we reduce osteoporosis to a great extent globally. Thank you so much.
Thank you. Bye-bye.
Bye. you.